As I was scoring, I was running sideways, and one of the players, who's the goalkeeper of the other team, went down on the floor to grab the ball, but in fact he missed, and he somehow grabbed my foot. So as he grabbed my foot, the momentum of my body sort of twisted my knee sideways, and I could hear two loud cracks. When I heard the diagnosis, I was a little bit moved, I have to say. I was kind of disappointed, as nothing major like this has happened to me before. Dr. Sparks was really good at sort of taking me through the diagnosis step by step, without just telling me, oh, you tore your ACL. He went through it, and he said there's a likelihood that you've torn it, and but this is not a problem because this problem can be fixed. There is a reconstruction surgery, and he said you don't have to have the surgery if you want, but you'll have limited activity. So again, he took me through the decision process really well. Part of my surgery was having the ultrasound guided nerve block, and that was really helpful because this surgery is extremely painful, and I think just having regular painkillers is not very efficient in the first 12 hours of the surgery. It basically consists of an injection to the side of the hip, and that injection reaches all the way to the nerves. And surprisingly, I thought that procedure would be very painful, but it wasn't, because they injected me with a painkiller before then. So it was a very seamless procedure. He told me exactly and very carefully to monitor the pain level as he was injecting the needle, and I could see it on the screen, he could see it on the screen. He was very slow and careful and meticulous, and I could tell him exactly what kind of pain I had, or if I had any. Usually it happened pretty much without any noticeable pain. After the surgery, I felt like at some point I could almost be ready to move, because I felt nothing in my leg, and that was really nice, because I needed transportation from the hospital to my destination after the surgery, which was Dick's house, where I stayed for a week. And during that transportation, I believe that it would have been very painful without the nerve block. DHMC was really helpful after the surgery in trying to set me up with a physical therapist as soon as possible. And I believe there are different schools in this, because some people let the patient stay for about a week before they start their physical therapy program. But I started from this, like, one day after the treatment. I was there and I was trying to bend my knee, and it was really helpful because, for one, psychologically, I feel that my knee is not that much impeded, because it wasn't. I was able to do all that stuff, all the bending and all the exercises. And for a second reason, they wanted to have minimized the loss of muscle weight in my leg, and by trying to put me on exercises as soon as possible afterwards.